be able to see like if people have joined or not. But to know the names and everything, it will be difficult. And it actually keeps on fluctuating on Facebook. So it's kind of tricky to figure out.
All
So,
right.
No, we don't. Yeah, we don't need names and anything. Just to check out. That's it.
Sure. So we are almost live on Facebook. So just give me a second. All right. So we are live on Facebook. So sorry, my laptop. Just give me a second. All right. Hello, everyone. Hope you all are doing well and safe. Welcome to another series of webinar. I'm Akansha Sahai, Project Manager, Rehab Path India office, and we are a Madison-based startup with the mission to fight addiction and mental health and help out the families struggling with addiction and mental health by connecting them to the right rehabilitation centers. And currently, we are working with around 1,700 rehabilitation centers in India. And in today's webinar, we are going to discuss about key elements of designing a treatment plan with Alpha Healing Center. And so basically, we are going to talk about the treatment plans, treatment duration, and so on. And our guest speakers are Dr. Parth, who's a psychiatrist, and Mr. Patel, who is the CEO. And we have Rajnandini Rathod, who is also part of Rehab Path team and is a MSc in psychologist. And she will be driving rest of the conversation for today's webinar. So it's going to be a one-hour session. Please feel free to drop your questions on a Zoom platform and on our Facebook page, and we will be taking them at the end of the session. Over to you, Rajnandini. Thank you.
Thank you. Thank you for the introduction, Akansha. And thank you, Mr. Patel and Dr. Parth, for joining us. So before we get into the questions, why don't you all introduce yourself first? Maybe Mr. Patel, you can go first.
Yeah. Thank you, Akansha and Rajnandini, and welcome all. Myself, Vijay Patel. I am the CEO for Alpha Healing Center. I have been associated with Alpha Healing Center since the day we launched the operations in India. And my background is that I have been with the pharmaceutical industry for 35 years. And one of the reasons of my being here is I myself was a smoker for 35 years, and last 6 years I'm sober. So I thought that the best thing that I can give back to the community is my experience of 35 years, how I have suffered and my family. And now that last 6 years I'm sober, how can I help others? So
okay,
that's from my side.
That sounds inspiring. Dr. Soni, can you introduce yourself?
Hello, everyone. I am Dr. Parth Soni, and I have been working at Alpha Healing Center for last 5 years now, since the inception of the organization. And my areas of interest, as you know, are de-addiction as well as general mental health, adult psychiatric issues. So we, along with our team at Alpha Healing Center, strive to give the best possible treatment to the patients suffering from mental health issues as well as addiction problems.
All right. Thank you, both of you, for the introduction. And I'm really looking forward to having this conversation. So first, let's start with a few questions about Alpha Healing Center itself. So could you just tell us a few things about Alpha Healing Center and share some of the key features that make it unique?
See, we launched Alpha Healing Center in April 2017 and have completed more than 4 years. And we have treated more than 900 patients, clients up till now. And few unique things about Alpha is we not only help the individuals suffering from substance abuse in recovering, but we also help him as a whole to integrate back in the society, which means that we help him boost his self-confidence, self-ego, self-esteem. So not only does he recover from his addiction, but when he goes back into the real world, his self-confidence and his self-esteem is much stronger, and that will keep him motivated and sustain his sobriety. Now, at Alpha Healing Center, our major treatment approach is psychotherapy and holistic therapies. In psychotherapy, we have individual counseling, group counseling, 12-step AA. And on the holistic side, we have yoga meditation, we have hypnotherapy, we have art therapy, and we have music learning skills. And besides this, one of the most important thing at Alpha Healing Center is that we keep the individual engaged throughout the day in multiple activities. So from 9 to 4, they are in their counseling sessions. And after 4 p.m., we have activities like organic farming, cycling, walking, swimming, gymnasium, cricket, volleyball, basketball. And in indoor games, we have table tennis, carom, we have billiards. So we have a host of activities which help the individual to modify their lifestyle and pick up some healthy habits. So once they go back home, they get tuned to certain activities which they can continue.
Okay, all right. So I understand that rather than just focusing on the symptoms, we're looking at a more holistic approach and trying to give the individual a better life itself, which sounds really good. So I think Alpha has been doing some really great work. Like you said, you've had over 900 clients. Could you tell me more about what are the sessions like for a person who's staying at Alpha Healing Center?
Dr. Parth, would you like to take this up?
Yeah, definitely. I would like to answer that part. See, primarily our main key areas of sessions our timings are between 9 a.m. to 4 p.m. During that, we have 4 group sessions, which are of 1 hour, 15 minutes each. And these group sessions might be of psychotherapy, art, occupational therapy, music learning skills, hypnotherapy. Along with these group sessions going on, there are individual sessions, which might include all of these sessions as well as some medical talks, understanding about neurobiology of addiction, understanding about cravings, the medical treatment part and all. So on an average, group sessions are of 1 hour, 15 minutes each, as well as individual sessions are of anyways around between 45 minutes to an hour. So from 9 a.m. to 4 p.m., there are these various sessions planned. And all the clients go through this on daily basis.
Okay, all right. Yeah, that sounds like a variety of programs, and it does sound very interesting.
Yeah.
Coming to the topic of the webinar, the elements of designing an addiction treatment plan, there are a lot of factors to consider while choosing a rehabilitation center. So what are the few things to keep in mind while choosing a rehab center? If you could just share some points.
Dr. Parth, should I take up or?
Yes, sir. If there is anything, I will add on.
Yeah. So Rajnandini, based on my experience and based on the worldwide evidence, there are 2 things which are quite important. One is the team of doctors that you have. So that includes psychologists, psychiatrists, occupational therapists, 12-step AAs, recovery addicts who comes for motivational sessions. And when I say about the team, there has to be a very strong teamwork between this psychiatrist, psychologist, and other therapists. So I would suggest that any family who is looking out for a rehab, the first and foremost thing that they should look into is the team of doctors that they have, whether they are experienced, whether they are Rehabilitation Council of India, RCI recognized, whether they have registered there, and whether the rehab that they are choosing, is it authorized to take patients, and do they have the license for that? This is one thing which is very important. The second thing, which I think Dr. Parth mentioned and you also asked, is the program structure. How does the program look? Because many times there are some myths associated with rehab. The number one myth is that people come, stay here, enjoy, and then they go back. So it would be very important for the family and the individual to understand what is the program like. Will it help them recover? Will it help them sustain their sobriety? So these are the very 2 important factors. And then the third and the fourth factor will be, how does the, other activities play around? Because besides the sessions, they need to keep themselves engaged in multiple activities. So that is one. And the last one, which I would say, is the food aspect, because whenever a person is in a rehab and when he plans to stay there for anywhere between 30 to 90 days or 120 days, food becomes a very important aspect. So the cafeteria, which provides the food, should be able to cater to the needs of the individual. So these are few of the things.
I would like to add on here, before commitment to any rehab program, if it is a voluntary rehab program, it adds on to the treatment outcomes. Ours is one of the voluntary rehabs where we don't take any patients involuntarily, because motivation to quit substance and recover is the most important thing in the recovery treatment. So if patient is forced upon, then there might be resistance in the treatment. They might be more in a detention center rather than a rehab center, and they might not be working on towards the recovery. Rather, they are just spending time. So if there are voluntary rehab centers, that should be also a criteria before deciding where to take treatment. So this I wanted to add. Thank you.
Okay, yeah. So from what I understand, the key points that people can probably look at is one, check how the team is, whether there are qualified people. Second is see if the rehab has the license or authorization to conduct the program. Maybe look at the program structure and whether it suits them. Also look at other activities that are available over there. And also nutrition, I think that aspect is often ignored in a lot of rehabilitation centers. And like Dr. Parth said, motivation and willingness of the client or the patient himself or herself is one of the most important things. Okay, so from what I understand, there are a lot of different approaches that rehab centers take all over India. So does one approach suit a person better than the other? Is there an approach that people should be looking for based on their problem? So how can they go about and choose a rehab center with the right approach?
Dr. Parth?
Yes, sir. Rajendra, a nice question. See, there are various rehabs which follow different approaches. Some rehabs are purely based on medical treatment. They do the detox, they do the medical treatment, and they discharge the patient. They follow up with the patients. There are some rehab which purely follow 12 steps, Alcoholics Anonymous or Narcotics Anonymous. There are many rehabs who are actually, we should not call them rehabs, they are more than detention centers. They just put the patients there, keep them there for 3 months, 6 months, 9 months to stay away from substance. They are not doing any treatment actually. So these are various approaches, but what is the evidence that recommends is the better approaches are the more approaches are there in a single rehab, the chances of recovery are more. What I'm trying to say is medical approach should be a part of treatment, not the whole treatment. Similarly, psychotherapy, the CBT, motivation enhancement therapy, should be a part of treatment. Then the results are good. Also, 12 steps should be a part of the recovery program. But the more they are, the chances of getting better results are there. So at Alpha, we combined all three approaches together, the medical part of the treatment, therapeutic part, as well as 12 steps part. And all three approaches we give to the patient. And some patients respond well to one, some respond well to another, but given together, this approach have better benefits and they give good outcomes compared to one isolated approach. So that's why we choose this model where we all work as a team rather than me being a psychiatrist. I will treat only medical part. That does not help much with many patients. So this is how we follow. And if any rehabs are providing such approaches, they should be given priority over other rehabs which just follow a single approach of treatment.
Makes sense, yeah. Mr. Patel, would you like to add anything?
I think Dr. Parth has covered most of the points with regards to the approach. The only thing that I would like to add here is that whenever a family is choosing a rehab, many times, you see, they just take the patients and go for admission. I would rather suggest that they take a deep understanding of what the rehab offers and whether the rehab has some good reviews, because today world over, one of the most important aspect is how are the reviews of anything that you go, whether you are in service industry or whether you are in a hospital treatment or whatever. So I would say that they should find in-depth insights about the rehab that they are choosing from. And one of the ways they can do is consult the psychiatrist, what they feel about the rehab that they choose, and as well as go in for Google reviews and try to get some insights about how the clients who have been treated earlier report about the rehab. So that is something which they can keep in mind.
Yeah, I think it's a very practical tip that people can definitely use. So yeah, like Dr. Parth also said, that a combined approach is best, a holistic approach is best, where addiction affects every aspect of your life. So it makes sense to use different approaches to treat each one of them. Okay, so my next question is,
Rajnandini, one thing I wanted to add here possibly, in this approach, the family counseling, the role of family is very important. And many of the rehab do not involve family members. Whereas at Alpha, one of the most important aspect that our team tries to address is understand the relationship. If there are any problems within the family, then our therapists call the family members and resolve the conflicts also. So family counseling, the role of family is a very, very important aspect in the recovery of the individual.
right, okay, that was actually the same thing with my next question. I was going to ask what the role of family is in recovery and how involved should the family be in the treatment process?
Dr. Parth?
Family's role, I would highlight as it is the best maximum support anyone can provide is the family, because your professionals, the doctors, the therapists, the sponsors are not going to stay with the clients in the recovery whole time. Families are going to stay. So family has to understand about the illness part. Many family members think that this is a bad habit or this is because of the bad company, this, that, and they keep on highlighting that he does not want to quit or she does not want to give it up. And this leads to conflicts between them. They don't understand the illness part. The person who is suffering from addiction, he or she might be understanding, but family is not supporting, which leads to more and more conflicts. So family, first of all, has to understand the illness part of the addiction, why it is an illness, what are the symptoms of this illness, what should be done for that, how to help a family member who is suffering from illness of addiction. And they should be there available in hard times, such as when a person is having severe stress, person is having cravings, not able to tackle various life situations and is craving for substances. What should be done at that point of time? So that is what we focus in our family counseling and family therapy sessions, to make them understand about it.
Right, okay, yeah, that makes sense. Since family is who is going to stay with the client after the person leaves the rehab, so they need to be well equipped with how they can help instead of worsening the situation in any way. Okay, so coming to the location of the rehab center, is traveling to a different state or a different city ideal for rehab, or is it better to go to a local rehab center? What would you say?
To be honest, Rajnandini, I think we discussed that if locally there are rehabs which meets the criteria of a good rehab, then one can look into it. But then if the individual has tried out the local rehabs and they are looking for something which is more, holistic approach, then they should not mind traveling to a rehab which fulfills those criteria. So I think that the most important criteria would be, again, the same thing, the team of doctors, the authorization, the treatment approach, the program structure, that should be the prime criteria for selecting a rehab.
Right, that makes sense. Dr.
Yes,
Parth?
yes, I would like to add there. Many family members are hesitant on sending patients very far away, or many family are very restricted to send their relatives locally. They might think that the person will procure substance in the rehab also. We cannot trust, so let him send him far away. Or many family will feel that if he goes far away, then we might not be able to be in touch with him or her for longer duration. So these should not be the criterias. As Vijay sir rightly said, if a rehab is fulfilling the criterias which can give good treatment, then the distance does not matter much.
Right, okay. Yeah, like we previously discussed, there are a few other factors that one has to check first, and location can come secondary. All right. Coming to a very important aspect, which people are mostly confused about, how long should the length of the treatment be?
Okay. And a very nice question, which we come often every time a client is getting admitted. We have this, okay, how long he should stay or how long we should keep him and all. See, a good treatment program with a good motivation is on an average between 10 to 12 weeks. So that we recommend, if a 90 days program with good motivation, the chances of recovery are very good. But this is in case of if a person only has addiction problem, one substance addiction issues, nothing else. But if a person has other psychiatric comorbidities like depression, psychosis, bipolar mode disorder, severe anxiety, sleeping difficulties, and multiple addictions, then it is very difficult to pinpoint how much days, how many months. We cannot predetermine the time duration, that how long he or she will need in a rehab. So that usually depends, and we ask the family members to get admitted for a month or two. Then, depending on the need, they can extend, depending on the needs. What are the goals they have achieved? What are the treatment areas that are yet to resolve? So, how will we plan them? And slowly, we achieve those areas and we achieve those targets, and slowly, the duration we can decide. But on an average, we recommend is 10 to 12 weeks with a good motivation. If motivation is doubtful, then even you stay for 6 months or a year, that does not matter much, because it is just a detention rather than proper rehab treatment.
Makes sense. So the kind of problem and the treatment goals are
Yes.
the factors in deciding the length of the treatment. Are there any other factors that you think you'd like to add, Mr. Patel?
I think if you look at the worldwide evidence, which is the wealth of the data across the globe, the evidence says that anywhere between 90 to 120 days is what is required for an individual to recover. And one of the reasons is that the more the individual stays away from the substance, better are the chances of his sustaining the sobriety. Okay, that is one aspect. But the challenge here is that you see that many times the family feels that you see the rehab people will always ask you to stay longer, and they think that this is a sort of a marketing gimmick, or they always want the individual to stay. So I would say that the family should keep two things in mind. One, the trust aspect. If they are coming to a rehab center where they are putting their son, they are taking a big decision. So trust is something that they should have. Once you trust the team of doctors, then the second thing is follow what they say rather than doubting. And we have been very transparent, we have been very honest, and everything that we talk is evidence-based. So that is what I would like to add, that families should trust once they decide that they want to go to a rehab, then the rehab that they choose, they should trust the psychologist and they should trust the psychiatrist. Mostly the psychologist, because he or she is going to be the primary therapist who is going to do the counseling work.
Makes sense. Okay. So trust is another important factor while deciding the length of the treatment.
Yes,
Okay.
yes. Just a thing I would like to add, as Vijay sir rightly said, what happens is decision is taken in haste because a person who is suffering from addiction is creating many problems. So family member find out, search out, okay, they immediately take the decision and admit in one or other rehabs. But then they regret or they feel bad, okay, we should send him or we should not send him. The doctors are not proper or this or that. And that leads to bad impression in the patient's mind also, where he feels that I am being dumped or I am being left in such a place which I am not comfortable at all. So it should be better that you check about rehab, you take reviews, you finalize, and then trust the treating team rather than just taking decision in haste.
Makes sense.
But Rajnandini, to give you a very simple and clear answer to the audience, whenever we are talking about addiction, the family and the individual should keep anywhere between 60 to 90 days in mind.
Mm-hmm. All right, yeah. I guess that sums it. So another question that I have about the length of the treatment is, does the length of rehab decide chances of relapse in any way?
Yes, Rajnandini, what we have seen in the evidence also, chances of relapses are less if the rehab duration is 90 days or more. Less in the sense, if a normal rehabilitation program of 21 or 28 days has 70 to 80% chances of relapse, then a 90 days program will reduce the chances of relapse to 50%. So 20 to 30% reduction in the relapse chances are there. Because the more a person stays in a clinical environment, the recovery is better, the understanding about the illness is better, and he or she is going through the illness aspect again and again, understanding about it, why he or she cannot have even one drink or one time substance or drug use, what are the consequences. So that is again and again and again grilled in the mind of that person. So relapse rates are reduced. But again, duration, as I said, it matters if the motivation is good. Then this reduction of relapse rates are there. If motivation is not there, then it might be even more also the relapse rates.
Okay, all right. So it does look like relapse rate might increase if people take hasty decisions and choose a shorter treatment plan. And I think people invest a lot of time and money into their addiction. So why not also invest some time in the recovery?
Definitely right.
Okay, so talking about relapse, how important is a relapse program and how can one choose one?
Relapse program is very important because we often communicate that relapse is a part of recovery. It is not that okay, you have to start from beginning and you have not done anything during last rehab program or something. But it's like you have learned many things, but there are some small things which are yet to be cleared, which are yet to be solved. So relapse programs focus on that parts which are yet unaddressed or which have not been fully addressed, and that has led to relapse.
Okay.
So many issues, many areas have been identified and worked upon that might lead to relapse, and they have been resolved. But there might be some new situations which have developed and led to relapse. There might be some situations which were there but which were not been addressed because of time duration was less, or because patient was not ready to address those issues at that moment and which were remained unaddressed. So during relapse program, such issues are identified, addressed, so that re-relapse does not happen and again same cycle is stopped. So it is like you have learned many things, but the remaining things which are yet to be learned and practiced, they are taught and they are made in the schedule. They are able to resolve those issues so that they don't relapse again and again. So relapse program mainly focus on those issues.
Makes sense. Okay. So you probably learn a lot of techniques in your treatment in the rehab, and then you go into the complex life situations and you apply them. And sometimes you might come across new problems, and I think that's something that relapse program help you.
Yes.
Is
Yes.
there anything else that you want to add, Mr. Patel?
I think Dr. Parth mentioned that if an individual, even after 90 days or 60 days relapse, the first and foremost thing is that the family should not give up. They should still give the support to the individual and immediately call their therapist and inform them so corrective action can be taken. And I always give examples of when we send our kids to school. Many times the child fails in one subject. We do not, you see, take him out. We always say, okay, let us strengthen our focus on that child by engaging him in private tuition, or by, you see, mother spending more time with the child. We always keep the child motivated. Now the same concept applies here. If an individual has relapsed, let's not, you see, bring back those triggers and make him feel so low that his motivation to quit also goes. Relapse, no problem. That is where the family should support and immediately call us back. And it is not necessary that if a person has relapsed, he should again come back for 90 days or 60 days. Many times the therapist can give once a week counseling, and that can help.
Okay, yeah, all right. That's very effective from what you're saying. I think people, when people relapse, they sort of lose trust and they feel like, rehab probably doesn't work for them. But they
Right.
need to understand that it is a process and it is a learning process where they go on.
Yes, that's where I would like to highlight. It's like patients suffering from diabetes, which is a chronic illness. Similarly, addiction is also a chronic illness. The rates of diabetes patient relapsing on the sugar levels is as high as 70 to 80%. So all chronic illnesses will have relapses, but that does not mean we give up the treatment. If a person suffering from diabetes, even after following everything, his sugar level shoots up, he will not stop treatment, but instead he will go again to the doctor. The doctor will change something, doses will be readjusted, so it is brought under control. Similarly, here also it is meaning that if a person with following everything still he is relapsing on substance use, that is even more important at that point of time that we take treatment rather than going away from treatment.
Makes sense, yeah. And I think all of these are very important points that people should know before they are approaching treatment. So they do not have unrealistic expectations and think that, in 1 week everything's going to get okay.
Yes,
Uh,
yes.
So I
Very
think
important point, Rajnandini. Thank you for bringing that up. That the family should be aware that keeping 90 days, 120 days does not mean that the individual may not relapse. There is a possibility, but even if the individual relapses, as Dr. Parth said, it is a part of the recovery. He can bounce back. It's not the end of everything.
right, yeah. And it also doesn't mean that you have to start from scratch. It just means that you've gone somewhere and then you're
Yeah.
going to go.
Right.
All right. So I have one last very important question. How can one avoid scams and find a rehab that they can really trust?
Vijay sir, it would be
How
better you answer.
can you repeat the question, Rajnandini?
Yeah. My question is, how can one avoid scams and find a rehab center that they can trust?
I think there are many websites where the individuals can go and look out for a rehab. Okay, that is one option. The second thing I would say is that they should consult their psychiatrist and seek opinion. I'm saying seek opinion. Finally, the decision will be of families. And last but not least, if the individual family who is looking for a rehab, they might be undergoing some therapies with the local psychologist. So seek their opinion and then, you see, come on the decision for that. The therapist, the psychiatrist, they should play a very important role in supporting the family to take the right decision. And last but not least, as I said, the family should personally go and visit along with the individual to see whatever claims are being made by the rehab, are they reality in practice or not. So I would say that even if they take few days, few weeks, but there are websites available where you can scan and go. One of the website there they can go is deaddictioncenters.in, which offers you a list of all India rehabs and they can find, they have a choice there. So they can take their decisions accordingly.
Okay.
And family members can also check the credentials of the team, the doctors, the therapists, whether they are genuine or not, reconfirm with the universities and check once before committing anything to any rehab or any program.
Makes sense. Yeah. I think like Dr. Parth, earlier you've mentioned that people often take these decisions very hastily and without giving it a thought. And I think people need to understand that you have to give it some time and understand the program, the people who will be working with you. All right. Okay.
And last but not the least, what happens is this rehab did not work. Let us try another rehab. Another rehab did not work. According to them, as I said, relapses are part of recovery. So if a person is relapsing, you are taking to another rehab. Another rehab, he has relapsed, so you are trying to, okay, let us send him to this rehab or another rehab. Rather than shifting to multiple rehabs and not getting any results, first work on the motivation of the patient and stick to a one team where that person can contact similar therapist and psychiatrist again and again and again and again, so that they can help him out. Otherwise, this will be like a trial and error option with many multiple doctors, multiple therapists, and patient is not getting any benefit from anyone basically because of multiple changes. That should not happen.
Right, yeah. As much as I understand, I think trust and connection is very important to the team that you're working with. And jumping from one rehab to other rehab is only going to make that work.
Yes.
Okay, so these were all the questions from my side. Can you take a few questions from the audience now?
Yes, please.
Sure, okay, I'll just go. Okay, there's a question. What if the family members are forcing the person to join the rehabilitation center? Or what if the person is in denial? What can be done in that?
Okay. Again, a common question and very much concerned most of the family members. What if he or she is not willing to come? If a person is in denial, he or she is in denial because we are there to diagnose him with addiction. Many times, what family members put is they judge directly, okay, you are suffering from alcohol addiction, you have become an alcoholic, or you are a drug addict. Let me take you to the treatment. There, it's more like a punishment to the family member rather than a concern. So if you are really worried about your family member who is suffering, who is taking substances, whether you don't know he is an addict or not, and you are not the specialist to claim that, okay, he or she is suffering. So in a private space, he or she should be talked about his substance use rather than judging him or her. Take him or her to a professional, to a psychiatrist, to a therapist. Let that specialist come to a conclusion and give a diagnosis. So this is where the most difficulty happens, because all the family members or friends or well-wishers, they themselves become the mental health professional and diagnose, you are having depression, you are having addiction issues, you are having this, that, you should go to the treatment. So it's like, I have diagnosed you, now you go to the doctor and he will help you or she will help you. So nobody likes that approach. So if we are really worried or concerned about the patient, take them in isolation when they are when they are not intoxicated, they have not used substance. Most of the family member talk to everything about this when the person has already consumed drugs. That does not work. So when a person is sober, he is alone, and talk to him or her in a manner of concern. Okay, we are worried about this, let us take a professional opinion, then we will see what we need to do. If you directly say, okay, you are suffering from addiction and we are going to take you to rehab, nobody will agree immediately. No? So it's better take this approach where you are showing concern.
Makes sense.
Right?
That's
Yes.
I think very good and practical tips that people can use. And there is so much stigma that is usually associated with addiction that it is seen as a moral problem.
Yes.
And that tend to take like an authoritative position and tell people that you are wrong, you need help.
Yes, and the family member also should be ready to discuss about their own alcohol or substance issues. See what happens if you confront, okay, you are suffering. They will say, you are also taking alcohol. You should also go to a rehab. No, I am taking under control. You are going out of control. So these conversations will not help. So it should be like better, okay, I am also suffering, or I will also get myself checked. Let us go together, have an opinion, and then plan ahead what should be doing. Second part, you asked, what if family member pressurizes a person to take admission in rehab? So this question might be from a person who is suffering from such issues of substance use, I presume. So that person should understand why a family member needs to. If you are doing well, if you are following everything, your career is on the path, why your family member will put you or think about forcing you to put in a rehab, right? There must be some or other issues. So you should talk to your family member about your concerns, your wish. Why do you think you don't need? They should express their opinion. Why do they think that you need rehab or something? And the better the communication is, the chances of recovery are good, and understanding about it.
Right. Okay. Makes sense. So rather than judging the person, the best way would
Yes.
be take a proper intervention
Yes.
and find out if things are really wrong.
Right. And
Uh,
what happens is, not all person who are using substances are suffering from addiction. Not all person who are drinking alcohol are alcoholics only. So many a times they might not be suffering. So it's like if a person is having chest pain, you don't diagnose him with heart attack and start giving treatment on your own. You go to a chest specialist. The specialist will do the ECG, check the vitals, and then, okay, this is mild acidity only. You don't need to worry about. Similarly, here also, if there is some concern related to substance use, take a professional help rather than diagnosing and treating or giving your own observations and suggestions.
Mhm. That was an amazing analogy. Is there anything that you'd like to add, Mr. Patel?
uh, the only thing that I would like to add here is whenever any family is in a dilemma where the individual is not convinced, I can share about what we do. Means when my colleague answers the call from the family, and if the family member says that, you see, my son is not ready, or my husband is not ready, or XYZ, what we immediately do is that the family is finding it difficult. So we immediately ask the family that would the individual like to talk to our therapist, our psychologist? And if the individual is ready to talk to the psychologist, that is the first thing that we do. Because despite several attempts, if the husband or if the son is not willing, a third person who is neutral and who is an expert psychologist, if she talks or he talks, I'm sure the individual will at least be open to that. So that is the first thing we do, and we don't charge anything for that. If we get a call from Mumbai or Calcutta or Delhi, wherever they call, and if the family says my son is not willing, he feels he does not have a problem, we say, okay, at least bring him to the level where he says, okay, talk to our therapist. We arrange a time where the family calls up the psychologist, and then they both talk, and it will be confidential. And it will be a very transparent talk. The talk will not be with the intent to get the individual to a rehab, but as Dr. Path said, the psychologist will make the individual understand that what currently is suffering from and what are the options available. Every time a rehab may not be an option. The therapist may say, okay, go for individual counseling with the psychologist once or twice a week. And if you can sustain that, that should be good.
Makes sense. Yeah. So rather than judging or jumping to conclusions, you can rather take like a informed approach and talk to a third person. Okay.
Yeah.
Sounds good. I'll look at the next question. Okay. Okay, so I think this is a very specific question. What is the typical length of a rehab a patient has to stay at the rehab if he or she is suffering from anxiety or depression from the past 25 years? So someone with a long-term mental health diagnosis,
Okay.
how
I
long
would
should...
say long-term treatment also will be there. How long we have to assess the severity of the illness, the current recovery of that patient suffering from any medical treatment are ongoing or not. So it cannot be this much with just one liner and I can answer in one line. But yes, long-term treatment will be needed. If on an average, if you can say 2 to 3 months at least to begin with. If needed, it might be even more.
Okay. I guess proper diagnosis and proper assessment
Yeah.
is required.
Yeah. Yeah.
Answer that. Okay. All right. Okay. There is, I'm not sure if it's a question, but I would like to see what you would say to a person who's saying this. Often family is concerned, what is the guarantee he will not go back to the substance abuse or addiction before investing so much, both money wise and time of the family and the patient? I'm sure this is something that is a common concern among families. So
Right.
how do you deal with that?
Yes, that's where a family also has to understand the chronicity of the illness. I am mentioning both these words with emphasis, chronic illness. So, chances of it's like you are asking your physician, what is the guarantee if I am taking insulin, my sugars will be always under control. If it goes out of control, I will sue you. It is not like that, and the body does not behave with such a, we are not machines which can come under guarantee or warranty that this many years it will be lasting like that only. And our interactions, our life is dynamic, it is changing every moment, so we cannot assure that part about guarantee. And any treatment you go for, even for minor surgery also, they will ask you for a consent that during this surgical procedure, if something goes wrong, it is not the doctor's fault or the anesthetist's fault. Why do they do that? Because they are also not 100% guaranteed that he will get out from the OT live and healthy only. Yes, the intentions are that. So the person who is asking might not be able to understand the illness part. That might be the reason to ask such question, but it is not like that where we can give a guarantee. Even we cannot guarantee, okay, tomorrow what time you are going to get up, like precisely at that time only. So it is very dynamic and we cannot assure anything in illness part.
Rajnandini, I would like to add here,
Yes.
and it's a very relevant question, that if the family is investing 2-3 months, if the individual is investing 2-3 months and money in a rehab, I would rather put it conversely, rather than looking for a guarantee. I would say look at what have been the success rate of that rehab. Okay, let's say if the success rate of XYZ rehab is 60%, then you should say, okay, 6 out of 10 people are successful. Should I take that, or should I go to a... So what will matter is that when the family is choosing a rehab, get it connected to the right person and ask them, what is your success rate? So I can talk about our alpha success rate if anybody asks us, because we have the data. Analysts have analyzed, our team of psychologists and psychiatrists have the data of last 4 years, and we share it very transparently, that if you stay for 3 months, our success rate is 70% or XYZ. And that is at 1 year follow-up. We don't guarantee 1 year follow-up. So I would say the family should focus what are the success rate rather than looking for guarantees and warranties.
Okay. I think transparency is also one factor that people can keep in mind while choosing their rehab center. Okay. And like I also previously said, that people often invest so much money and so much time into their addiction. So it does make sense to go ahead and invest that time and money in the...
Recovery, yeah, definitely.
Okay, moving forward to the next. Okay, so there's a question asking, usually patients who are addicted, they never accept that they are into it. I think this is another question about denial. Is there any way or trick by which we can make them believe that they are actually suffering and they agree to go to rehab? I think
So
we
that's,
have...
yeah, I have answered. You have to take them to a professional rather than you diagnosing them with addiction. We are not here to punish anyone. We are not here CBI officers. Okay, you are the criminal and this is the proof that you are the criminal. So this is that approach, confrontational approach. That does not help in treatment part. So better take that person to a professional and see. What we see is most of the people suffering from addiction do accept that they are suffering from problems, but once they are in proper hands and properly interviewed, where they are comfortable that they are not being judged, where they are not being punished, so they open up and they say also many things that they are not able to come out of it. They have tried many times, but for that you need a little different approach that we traditionally use. Yeah.
Okay, yeah. So rather than judging the person, if you really want to help them, it's best to
Yes, professional. Yeah, yeah.
And Rajnandini, I think Dr. Parth mentioned that earlier. Let's say if an individual is not agreeing that I have a problem, right? Now, the reasons could be two. One, he might have some wrong myths about the rehab, that if I agree and if my parents push me in a rehab, that his experience with where he would have heard somebody saying that is a torture center and those rehab, they keep you tied up and all that. That could be one. And second thing could be that, okay, I don't have any problem. I do it under my control and I can quit anytime. I'm doing it for fun. I can quit anytime. So as I said, the best approach Dr. Path said would be that seek professional help. And that is where the role of rehab comes, that transparently we arrange a talk between the individual and the psychologist or the psychiatrist. And if the psychologist and psychiatrist are able to help them and make the individual understand, then he comes with his own willingness and motivation. And we guarantee them that when the psychologist talks to the individual, he or she tells the individual that this is a voluntary rehab. So without your consent, we will also not admit you. Even if your parents say that please admit my son or daughter, we will not admit them till the time the individual agrees. So that is where the individual can be given that assurance by the family that let's go, let's get ourselves assessed. If you feel you can take admission, if you don't, go back. We will give you the right advice even if you do not want to take admission.
Okay, yeah. I think giving some authority to the client himself or herself builds a sort of trust, right? And the psychoeducation and more awareness about how the treatment is going to be also helps deal with denial, I'm sure. Yeah. Okay. So can we move forward to the next question?
Yes.
Okay. If a person is suffering from multiple addictions, can he be treated simultaneously for all addictions?
Definitely, yes, he or she can be treated simultaneously. That should not be a problem. His motivation and intention to quit should be there. That is more than enough. We can help him or her with medical treatment, with therapeutic approaches, with 12 steps approaches, and definitely he or she can be helped upon to recover from multiple addictions. See, addictive behaviors are there. A person might be using multiple substances to feel good or get rid of negative emotions, but definitely they can be helped upon with treatment.
Okay, all right. So it's almost time, so I'll just pick one last question.
Yeah.
A friend of mine is addicted to cricket betting since college days. He is on and off. Do you treat such cases?
Yeah, gambling addiction, what we say is, and part of it is betting, online betting on various games or something. Yes, definitely, it is also an addiction, a diagnosed condition. So he or she needs to take a professional opinion, and he or she is willing to come, then definitely we do. And we have treated more than around 30-35 cases since last 4 years of gambling, pure gambling rather than any other substances.
Okay, all right. Okay, that's it, I guess. Thank you so much for answering all of the questions. Okay, over to you, Akansha.
Thank you so much, Rajnandini. Thank you so much, Dr. Path, Mr. Patel, and Rajnandini for such an insightful session. I'm sure it will help a lot of people in our network. And thank you so much for answering all the questions also in such a detailed and nice way. So before we conclude, can you please share a message as a psychiatrist for the audience, Dr. Parth, and also Mr. Patel, if you can also share some message for the audience.
Yeah.
Yes, I would like to say that all of us have to understand that substance use disorder, right now, the new term for addiction is that it is not addiction anymore. And substance use disorder, the last word disorder is deliberately put to make people understand about the illness aspect. Any disorder means some or other areas of our body are not functioning properly. And in substance use disorder, various areas of brain are disturbed, affected, because of which there is lack of control. They keep on doing same behavior again and again in spite of negative consequences. There are lots of cravings. There are withdrawal symptoms if they don't use substances. And they want to stop, but they cannot stop. So this means this is a clinical condition which needs treatment rather than lectures or sermons or success stories of some or other relatives. My family member has stopped, so why can't you? This, that does not help much. Rather than professional approach with treatment, proper treatment will definitely help a person who is using substances and suffering from substance use disorder. Thank you.
Thank you so much, Dr. Parth. Mr. Patel, if you can share something.
Yep. I would advise that for the family, where the family is having any individual or any close member, near and dear ones with such problems, they have to understand one thing, that this is a disease, as Dr. Parth mentioned. Just as somebody suffers from hypertension or diabetes, addiction is a brain disease. So it is very important for the family to extend that support to the individual, because the person who is suffering from addiction, he is beaten down on all sides. And that is the time when the individual expects support from the family. And at that time, if you are not going to empathize with him or extend that support, the only thing you are doing is push him in down, down, and down. Okay. So I think it is very important for the family to extend the support without any, preconditions. Many times the family says, okay, I am ready to spend for you, but then I want that once you come back, you should be out. This type of statements further demotivates the individual. So the best thing, let the family extend the support. There are professionals who are there to help. There are good rehabs who are there with a good success rate. Seek their help. And I'm sure the near and dear ones will bounce back, and the family will be back in action.
Thank you so much, Mr. Patel. Thank you so much, all of you, once again for the whole session. Such a nice session. And thank you once again to our whole audience for the active participation. So we'll be back again with another webinar. And till then, please stay safe and take care. Thank you so much, everyone.
Thank you.
I would also like to thank the rehab path, because it's easy for us to answer the questions. But I know last 3-4 days, the rehab path team, Adarsh, Akanksha, and Rajnantini, thank you so much. You have also played a very important role. So thank you so much, and look forward to meet you again. Thank you.
It's a pleasure, Mr. Patel. Thank you. Thank you all as well.
Yeah.
All right.
All right. Thank you so much, everyone. Bye-bye.
Thank you. Bye.